Hey there, welcome to my channel. Really appreciate you being here. So, the other day, and by other day I mean about 2 months ago, I I had to go to the ER very unexpectedly, like 2 o'clock in the morning. I had really horrible abdominal pains, like worse than I've experienced before, ever in my life. I mean, I was ready to like choke myself out just so I could go unconscious and not have to experience pain anymore. So anyways, pretty big deal. I don't ever go to the hospital or the doctor for any reason at all. The only other time I've been to the doctor was for a physical checkup, which was required by work back when I was a mover in like my early to mid 20s. So hospitals, doctors, not something I do. If it looks really bad, I'll just tough it out. So this is a really big deal. So I rushed to the ER 2 in the morning because I tried all the usual things that could have been, things that could have alleviated the pain and whatnot, and none of it was working. So I was at my wit's end. I didn't know what was going on. I didn't know, all the thoughts are racing. So anyway, hindsight learned it was most certainly stress-induced. The abdominal cramps were at the hospital, at the ER. They ran my blood work. They did a CAT scan, and a whole bunch of doctors and whatnot were, or not a whole bunch, but there was 2 or 3 nurses that were trying to figure out what was going on with me. Couldn't figure anything out. They just showed like my hydration levels were low, even though I was chugging water and ginger ale like crazy to try to help my stomach, see if maybe that'll help. So anyway, made no sense whatsoever. They even gave me a little sheet telling me like what all the causes were or what all the symptoms of dehydration were, and I had none of those things. So none of it made sense. And then basically all they did was just jacked me up with a whole bunch of IVs of saline, gave me like 2 or 3 bags of saline, dealt with the IV and all that and how terrible that was. Side note, I'm like super needle phobic. Like I would rather get stabbed with a knife than a needle. Like they just freak me out bad. Anyway, oh yeah, the time before this was when I was at MEPS donating blood, or not donating, I was giving blood so they could do some blood work, and I blacked out and was trying to punch the nurse. So warned the ladies like, hey, by the way, this last time happened. Anyway, yeah, so all said and done, basically 2-3 bags of saline, good to go, went home. And then, loaded up on Powerade after that, just in case. But yeah, it's most likely due to stress. They had no idea what it was, had no conclusive results. And then they had me call later, or they offered a phone call later, to which I accepted. It was like, yeah, I want you to call me because I have questions. Oh, in the event that I have questions. There we go, forgot that detail. Anyways, like, yeah, I have questions. So anyway, they gave me a call, and it was... Because I've had years of sales experience and I know sales training and I'm familiar with it, I was able to pick up on this, but I don't think the average person would. But she was essentially, she didn't answer any of my questions that I had. She was essentially just trying to upsell me to have me start doing like a regular scheduled checkup with one of their hospital's doctors. I'm not going to mention the hospital or who it was that I talked to. I've got my form here with all the information on it. I considered taking a picture of it and showing all the numbers, and I'll talk about the numbers and whatnot. Then I was like, there's specific names and people and locations of stuff, and it's probably best to just not have it on the internet. So anyway, so these people basically just trying to do the best that they can with the tools that they've got, and then yeah. So anyway, all said and done, finally got the bill. It says I got it at the beginning of June, but that is very untrue. I think I got it about 2 weeks ago, maybe. So anyway, not sure if it got lost in their mail system for, 2 weeks or something like that. But anyway, so I finally got it, and here are the results. Oh, yeah, side note. When I was there about to get treatment, before they did anything, I was like, well, how much is this going to cost? And they're like, I don't know. You can look it up on their website. So looked it up on the website, no information. No way of knowing what any of the costs of any of this stuff was going to be. Supposed to be itemized. It was not. So yeah, I went into all of this completely blind. I had no idea how much I was going to be spending, but I was in a time of need and didn't know what else to do. So yeah. Oh, also fun fact, they gave me a full dose of morphine and it had 0 impact. So apparently I am immune to morphine, which is interesting. So anyway, just another little tidbit. So we got the bill, and it has 3 items on it. That's it. Just 3 items. Nothing specifically detailing. It just says the name of the hospital, emergency services. That is $8,460.20. So very specific number. Nothing describing why that is $8,460.20. Just the fact that because I was there, they charged me that. No other reasoning. Then it has the name of a person and their group and the hospital name. They're basically with the radiology department. I'm going to assume that this was probably the person that did the CAT scan. So the CAT scan cost me $263. I was talking with my coworker, and her wife had a CAT scan, and that CAT scan, even with the best, most premium insurance, cost $8,000. Not sure where this pricing comes from. So $263 for my CAT scan. I don't get it. So anyway, then it has the name of the, I believe is the doctor that talked to me, the group they're with, and the hospital. But it says physicians. So along with this big long description. And that was $384. Still not sure exactly what constitutes this breakdown or why specifically. Just these are just dollar amounts. So the grand total is going to be some like $9,000. $9,000. I don't have health insurance because I think it's stupid. I don't believe in paying an obscene amount of money on the off chance that something might happen, and if it does, I still have to pay a lot anyway. So because I don't have health insurance, the item 1, the emergency services, that is $8,460, still no reason why, they're going to reduce the amount by $5,547.35, meaning the amount that I actually owe is only $2,912.85. I say only. So the reality is, it doesn't actually cost $8,000 to do what I did. It really only cost $2,900 of whatever itemized stuff that is. So yeah, also the CAT scan was reduced by $105.20. So that CAT scan actually cost me $157.80. And then the doctor visit was reduced by $153.60, meaning that I only actually have to pay $230.40. So all this said, all these expenses don't actually cost this much. The hospital is inventing costs so that they can overcharge insurance companies so that the insurance companies can overcharge you. It's the biggest flippin' scam ever. So clearly insurance is not the answer to the way forward with the American Health Institution. So this is my very first ever experience with American Health or the American medical system, health system, whatever, healthcare, what do you want to call it. And I was very surprised. Yeah, so I basically owe $3,300 for this hospital visit, which was 3 bags of saline, and I don't know what is wrong with you. Peace be with you. That was the extent of what I got. So anyway, I still don't think the $3,000 justifies the actual amount, but the real kicker is a $5,500 reduction. Actually, it's closer to what's that? $5,800. So $5,800 fewer dollars because I don't have insurance. It's the biggest friggin' crock. So I only bring this up because I've heard, this is a really deeply complex issue. I've heard a lot of things that a lot of people have said about like, oh, we need to have universal health care, we need to have universal health system and all this kind of stuff. Clearly insurance is not the answer. That is not the way to go. Legitimately, the one and only thing I was actually excited about for Trump was that he was going to kill Obamacare. Literally the only thing I liked about the guy. He's killing Obamacare. It's like, yeah, that's a positive. So I don't know the best way forward. Definitely transparency in your billing practices is first and foremost. That absolutely needs to be a thing. That needs to be public information, widespread, easy to look up, easy to research. I know dentists, they did that several years ago, and the rates for dentists became incredibly competitive, and now going to the dentist is nowhere near as bad as apparently what it used to be before they were forced to become transparent. So anyway, I think transparency on their charges and what things cost should definitely be addressed. personal thoughts. Love to hear what you have to say in the comments. So please feel free to, leave a comment. Also, if you like the video or just like having this discussion happen, please leave a like button. And if you want to see more videos or be reminded, please subscribe to the channel. It really does wonders for me. Personally feel good, and also it helps the YouTube algorithm so more people can find me. So anyway, thank you much. Really appreciate you showing up, and bye for now. Stay classy.